guys, Raquel, Chelsea. We're here to talk to you about lab values and how they relate to our patients that we're treating as respiratory therapists.
While these may not all seem respiratory related, they give us a better idea of the patient's overall health and why we're treating them.
So specifically, we're going to be talking to you about two tests, a CBC, a complete blood cell count, and a CMP, a comprehensive metabolic panel. I will start first regarding a topic of CBC, and then Chelsea will talk to you about the CMP. So covered in a CBC, when it's ordered, they are going to do a red blood cell count, a hemoglobin, hematocrit, platelet count, and then all our white blood cells, which include our neutrophils, eosinophils, basophils, monocytes, and lymphocytes. So starting with the red blood cells, we know this is useful to assess our patients' oxygen carrying capacities. Hemoglobin specifically is the protein that allows the oxygen to bind to these red blood cells to carry our oxygenated blood from our lungs throughout our body and our system. It returns to the lungs as deoxygenated blood carrying CO2, which we exhale out, which we excrete out of the body during exhalation. This is important to know for assessing, again, if our patient's anemic, those values are going to be very low, and that could be a problem with oxygenation. Hematocrit is basically just a proportional test. It's basically telling us how much red blood cells to plasma ratio is actually in our blood, which is important as well because we need, an abundant amount of healthy red blood cells to carry the oxygen throughout our body. Platelets are our clotting factors. They form our blood clots, our blood clot formations. So people who have a high platelet count are typically at risk for strokes, heart attacks, and more importantly to us as respiratory therapists, DVTs, deep vein thrombosis, due to the fact that when things go untreated, they could get dislodged, move throughout our body, end up in our lungs, and result in a pulmonary embolism. So as we know, treatment for that would include fast-acting anticoagulants, thrombolytics, any therapies to break down and prevent the blood clot formation. So moving to our white blood cells, which are also known as leukocytes. These are the cells of our immune system. They are designed to protect our bodies from invaders, protect us from infections and diseases. We'll start with neutrophils, which is typically our first line of defense. They're the first cell, or white blood cell in our body to respond to the site of infection or inflammation once it's detected. They're very sensitive to bacterial infections, so typically with the elevated neutrophil count, it is a sign of a bacterial infection. An example of a bacterial infection pertinent to us as therapists would be a bacterial pneumonia, which also could lead to VAP if our patients are on a ventilator. They're typically two associated. Also, take note of you could have an increased level if your patient has been on long-term corticosteroids. We see elevated levels in the neutrophils as well with our patients who take a lot of steroids. So specifically to know about neutrophils, they contain an enzyme. It's called lysosome. It targets the bacteria. It targets them and breaks them down. That's their defense. That's their process there. Secondly, we'll talk about eosinophils, which eosinophils mediate our inflammatory response, especially with allergic reactions and asthma, specifically bronchial asthma, and seasonal allergies, which we know is rhinitis. They also release toxins that kill parasites. That's just something that eosinophils are known to do, specifically target parasites, like neutrophils specifically target bacteria. A lot of times, me personally, and in my experience as a student, so extensive, I see a lot of increased levels in eosinophils when we do bronchs, when we do the balls, the lavages, to clear like heavy amounts of secretions with our asthma patients, or just people who have tons of secretions in their lungs that we can't get out. We lavage them. You know, typically we take a sample, send it to the lab. It usually comes back high in eosinophils, so that's just something to be mindful of. Basophils are similar to eosinophils in terms of they are also mediators that cause an inflammatory response. Once they sense an injury or invader, whether it's, you know, allergic or some type of damaged tissue, they rush to the site, they release a histamine, which in turn causes a inflammatory response, you know, the swelling, the inflammation. That's what they do. That's their protection mode. That's what they're designated to do. Those two are increased during allergic reactions and seen during asthma attacks. So next we're going to go into monocytes, which monocytes are phagocytes that are carried through our bloodstream. They circulate, they're there, they're present, whether we need them to be or not. Not in large numbers, they're just circulating through the blood system, and they're waiting to come across like and ingest a invader, foreign body, anything, foreign material. So they circulate through our blood system. Once they sense something's not supposed to be there, they go, they engulf it, they ingest it. So that's why they're called phagocytes, because they perform phagocytosis. To us, this is beneficial as RTs because it helps rid the inhaled matter found in the alveoli, so it targets that. And then lastly, I'm going to talk to you about lymphocytes, which again, they increase during infection or other inflammatory conditions. A temporary increase in lymphocytes is good. It shows your immune system is working. When it's consistently high, that might indicate a more serious condition like leukemia. And in turn, consistently low is also bad for us and our patients because it leaves us, you know, not defenseless, but weak. We're more susceptible to getting those viruses, those bacterial infections, fungi, parasites. Our body isn't going to be strong enough to fight those off if our lymphocytes are too low. So it makes us vulnerable.
Okay, so next I'm going to be talking to you guys about a CMP, also known as a comprehensive metabolic panel. A CMP is a group of blood tests used to evaluate the body's overall chemical balance and metabolism. The results can tell us about kidney and liver function, blood sugar and calcium levels, electrolyte levels, and protein levels. For this test, patients should not eat or drink anything 8 hours prior. The first thing I'm going to be talking to you about is albumin. Albumin is a protein made in the liver. Elevated albumin can be caused by acute infections, burns, or stress caused to the body from heart attack or surgery. Treatment for elevated albumin includes antibiotics or just treating the underlying cause. Decreased albumin can be caused by malnutrition, so the treatment for that would be better nutrition or better diet, such as eating foods with a lot of protein, such as nuts, eggs, and dairy products. Okay, so next thing I'm going to be talking to you guys about is alkaline phosphatase. This is something that's produced by the liver, and it's an enzyme. Reasons for elevated alkaline phosphatase include liver disease, bile duct obstruction, gallbladder disease, or bone disorders. Treatment for elevated alkaline phosphatase includes liver transplant, clearing of the bile duct obstruction, or treating the underlying cause if possible. Reasons for decreased alkaline phosphatase include a rare genetic disorder called hypophosphatasia, which basically affects the bones and teeth. It can also be caused by zinc deficiency or malnutrition. Treatment would be healthy and more well-balanced diet. Next is also an enzyme made by the liver, and it's ALT, also known as alanine aminotransferase. So most common cause for increased ALT is liver failure or disease, but elevated levels can also be due to drug-induced injury, hepatitis B and C, hereditary hemochromatosis, alpha-1 antitrypsin deficiency, autoimmune hepatitis, and Wilson disease, which is a genetic disorder linked to excess copper in the body. Treatment for elevated levels include medications, liver transplant, or treating the underlying cause. Low levels of ALT are actually expected and considered normal. The next is AST, which is also an enzyme made by the liver. AST is aspartate aminotransferase. Elevated levels can be caused by an MI, liver disease, pulmonary infarction, or skeletal muscle disease. Treatment would be liver transplant or treating the underlying cause if you can. Reasons for decreased AST include pregnancy. While lower levels can be seen with pregnancy, this result is still considered normal. Okay, next is BUN, or blood urea nitrogen. BUN is a waste product removed from your blood by the kidneys. Increased levels causes could include adrenal or renal insufficiency, CHF, dehydration, decreased renal flow, GI bleed, shock, or urine obstruction. Treatments for elevated levels would include fluids for dehydration, or again, treating the underlying cause if possible. Some of these cannot be resolved, they can just be treated to the best of our ability. Reasons for decreased BUN include hepatic failure, low protein diet, nephrosis, or pregnancy. Treatment would include a higher protein diet or, again, treating the underlying cause. Next is going to be creatinine. This is a waste product removed from your blood by the kidneys. Reasons for elevated creatinine levels include nephritis, renal insufficiency, or urinary tract obstruction. Treatment of this would be treatment of the nephritis or the obstruction and dialysis for renal failure. Lower levels of creatinine could be caused by a debilitation or a decrease in muscle mass. So this would include things like muscular dystrophy, where your muscle mass is weakened. For this, there is no cure usually, but sometimes a corticosteroid can help improve the muscular strength in these patients. Okay, so next we're going to be moving on to the electrolytes. The first one's chloride. So increased chloride can be caused by cardiac decompensation, renal insufficiency, or your salt intake. Treatment would include managing salt intake, dialysis for renal failure, or treatment of the cardiac issues. Causes for decreased electrolytes, such as chloride, include COPD, Cushing's syndrome, dehydration, DKA or diabetic ketoacidosis, diuretics, fever, metabolic acidosis, and pneumonia. So treatments for decreased chloride would include fluids for dehydration, managed diuretic usage, antibiotics for pneumonia, or treatment of other causes. Okay, so the next electrolyte is potassium. Increased levels of potassium, also called hyperkalemia, can be caused by acute kidney failure, chronic kidney disease, Addison's disease, or internal bleeding. Treatment of this would be dialysis, diuretics, or a medication known as resin. Lower levels of potassium, also called hypokalemia, caused by diuretics, adrenal gland deficiencies, and genetic disorders or syndromes, and the treatment would be potassium supplements. The next electrolyte we're going to be talking about is sodium. Increased levels of sodium can be caused by diarrhea, adrenal gland disorders, kidney disorders, or diabetes insipidus. Treatment would include replenishing fluids by IV, which could be 5% dextrose for acute or 0.45 normal saline for chronic issues. Decreased levels of sodium can be caused by medications, heart, kidney, or liver problems, chronic dehydration, or hormonal changes. Treatment for decreased levels of sodium would include normal or hypertonic saline. Okay, so next we're going to be talking about calcium. Calcium is one of the body's most important minerals, and it's essential for proper nerve, muscular, and cardiac function. Reasons for elevated calcium levels could include acidosis, adrenal insufficiency, diuretics, immobilization, sarcoidosis, or tumors. Treatment would include managing adrenal insufficiency, limiting use of diuretics, or treatment of acidosis and other causes. Decreased levels of calcium can be caused by alkalosis, diarrhea, hyperproteinemia or low protein levels, osteomalacia, renal insufficiency, steroid therapy, or vitamin D deficiency. Treatments for this would be supplements, dialysis for kidney failure, protein, or limited steroid use. Okay, so next we're going to be talking about glucose. Glucose is a type of sugar and our body's main source of energy. Reasons for increased glucose, also known as hyperglycemia, include diabetes, lack of insulin usage, inactivity, and poor diet. High glucose levels can also be linked to COVID-19 and be helpful in determining the severity of it. Treatment for this includes insulin, water, exercise, lifestyle changes, and medication use. Decreased levels of glucose, also known as hypoglycemia, can be caused by medications, excessive alcohol usage, insulin overproduction, or hormonal deficiencies. Treatments for decreased levels could include fast-acting carbohydrates, sugar, medications, or cutting back on alcohol. Okay, so next is CO2 or carbon dioxide or bicarbonate. Reasons for increased CO2 levels are lung conditions such as COPD, which we're all very familiar with. Treatment would include effective ventilation, oxygen therapy, and certain medications. Reasons for low levels of CO2 could include DKA or diabetic ketoacidosis, kidney disease, and metabolic acidosis. Treatment for this would include controlled breathing, medications, or oxygen therapy. Okay, so the last two things I'm going to be talking to you about include total bilirubin and total protein. Both are just the total measurements found in the blood. So increased total bilirubin causes can include anemia, cirrhosis, Gilbert syndrome, viral hepatitis, drug reactions, alcohol liver disease, and gallstones. Treatment for elevated levels would include correcting the underlying cause. Reasons for decreased levels of total bilirubin include very strenuous exercise, caffeine, penicillin, and other medications, and generally lower than normal bilirubin levels are not an issue. As far as total protein goes, elevated levels can be caused by dehydration, Hep B or C, HIV or AIDS, and other conditions. High protein levels rarely cause any problems, but may be an indication of a serious medical condition. Decreased levels of total protein could be caused by liver or kidney failure, malnutrition, and some other diseases. Treatment would be a better diet or the treatment of the other disorders. So hopefully this information was helpful to you guys, either as a reminder or something that you can take forward to your patients in treating their respiratory issues.
That way when you're looking through their charts, you can keep an eye out for certain values, and maybe this will be a helpful inclination of what's going on. So again, we hope you take away something from this video and it helps you in your respiratory therapy career. Thanks guys.